Hello, my name is Carolyn Baylor, and I'm a speech-language pathologist at the University of Washington in Seattle, Washington. I'm doing a short series of videos for people who have head and neck cancer and their family and friends about staying connected through communication throughout the journey of head and neck cancer. In this video, I would like to visit with you about communicating, particularly with your healthcare providers. As you know, you are going to a lot of healthcare appointments, and you might have noticed that your healthcare providers are not all equally familiar with how to interact with somebody who may be communicating in a different manner. And so here are some tips to hopefully help you with those encounters. People experiencing head and neck cancer may experience a very wide range of impacts on their communication. Some people experience changes to their speech and voice. Some people will experience what we call brain fog or some cognitive slowness during this time. For some people, those changes may be very, very mild or very, very temporary, whereas other people may experience very notable changes or very long-term, even permanent changes. Regardless of the extent or duration of any challenges you may be experiencing, you are probably needing and wanting to be staying engaged in life and out in your community as much as possible. And so I want to talk a moment about the concept of disability. Now, the word disability can be kind of a charged word. Some people are fine with that word. Some people do not like that word and would not refer to themselves as somebody who is disabled. So I respect that you might have your own opinion about the word disability. I will use the term today as it is a common word that is used. But one of the things that I want to emphasize is a philosophy related to disability justice. And one of the conversations that is being had around the topic of disability is what creates disability. For a moment, let's step away from the topic of head and neck cancer. In this slide, you see an image of a woman sitting in a wheelchair facing a large staircase. Clearly, because she uses a wheelchair for mobility, she is not able to get up that staircase, at least on her own, and have access to whatever may be in this building on the upper levels. Now, traditionally, people might have thought, well, the reason this person is disabled is because she is unable to walk. She does not have the physical function to walk up the stairs. However, those viewpoints are changing. And in newer theories and models, we are saying that the source of disability is not in the person and in how they function, but what really creates the disability in this picture is the staircase. The disability comes from the world around us being constructed and created in a way that denies all people equal access to the spaces, activities, and opportunities in our communities. For example, in this building, with appropriate ramps, stairwells, wide doorways, automatic doors, or everything just built on one level, this person would have equal access as every other person using every other form of mobility, and therefore the physical function would not be a disability at all. So I want to encourage us to take the mindset in this video that disability for those people who are experiencing communication changes with head and neck cancer, the disability is not necessarily because you are talking differently or thinking differently. It's because of the barriers that you might be facing in the world around you that makes our world a difficult place to communicate. There is actually a communication bill of rights that emphasizes that every person should have equal access to communication opportunities in the environment around us. And so what I want to encourage us to think about today is how can we identify, confront, and reduce the barriers in the world around us that make communication difficult. So what are the communication barriers that you might be facing? Well, it's not really a set of stairs, But for people with communication disabilities, it can be a lot of other things. And you may be recognizing some of the things on this slide that make communication difficult. Talking on the phone. Many people with speech and voice changes find that it's very difficult to be understood talking over the phone using voice. Text over the phone can be much easier. Your smart speaker. Does your smart speaker recognize your new voice or your new speech? Researchers and engineers are working on making smart speakers smarter to recognize more forms of speech, but that may take some time. Background noise, noisy environments, speaking over distance can make it really hard to communicate. Trying to communicate in crowded areas is really tough. Have you tried drive-throughs? Many people find that trying to order food through a drive-through is very, very difficult, and they don't have that convenience. They have to park and go in. You might be noticing other barriers to communication in the world around you. The place that I would like to focus on primarily in this slide set is our healthcare settings. It is so important right now while you are going through the experience of head and neck cancer that you are able to communicate clearly, easily, and efficiently with your physicians, nurses, therapists, and other healthcare providers. Clear communication is so important for you to get the healthcare that you need as well as the support you need. But interestingly, most healthcare providers, doctors, nurses, therapists, the people working in the lab, people working at the front desk, information desks, they typically receive very little or no training or orientation on what is a communication disability and how to interact with somebody who may communicate differently than they do or perhaps the typical person does. And so when you go into your healthcare setting, you may come across many people who really want to help you and really want to care about you, but they really don't know the etiquette or the strategies for communicating effectively with you. So unfortunately, that means that some of the advocacy may fall for you and your family members to let healthcare providers know what you need. What I want to do is encourage you to do that advocacy for yourself and your loved ones. It is good. It is absolutely right for you to speak up, literally or figuratively, and let the people who provide your healthcare know how can they communicate with you more effectively and more respectfully. So just a few tips of things you can do. First, prepare ahead of time for your medical visits. If it is hard for you to talk, if it takes you a long time to get your words out, if you are concerned that when you are there in a healthcare visit, you might get extra tired, it's hard, it's tiring to go to these visits. So you might get tired, you might forget what you want to communicate about. Plan ahead of time by you or your family member helping you. Make a list of what are your questions or concerns. What is it that you want to be sure your healthcare provider knows about your recent experiences or your symptoms that you can convey to them? What is it that you want to be sure that you ask about? What are the things that you are worried about? Write those things down so that when you go into your healthcare appointment, you can either read off that list or refer to the list, or you can even simply hand that list to your healthcare provider for them to read and talk about with you. Talk with your close family or caregivers about what their questions or concerns are. They may have some observations or some thoughts or ideas or concerns that might not be on the top of your list. And it's really important for caregivers and family members to have their questions addressed as well so they can help support you. Do this ahead of time, as in like a day or two ahead of time, not 5 minutes ahead of time. Again, you need to pace your life a little differently because of the fatigue and endurance challenges you might be having. So sit down a few hours or a day or two ahead of time to start this list. So over that 24 or 48 hours before the appointment, you can keep referring to this list and adding things as new ideas come up. Being rushed is never successful. Let your healthcare provider know how you communicate best and how they can help you. Remember, most of your health care providers may have very little experience or training in how to communicate with you. Some people, like otolaryngologists, will meet a lot with people who have head and neck cancer and will be more familiar with how you communicate, but not everybody is. One of the things is that we are very aware that healthcare providers are rushed for time. I hope your healthcare providers are giving you the time that you need, but we know that they are all on a very tight schedule. So again, if you let them know how to communicate best with you and do things like preparing information ahead of time, you can actually help them out by making the appointments more efficient through your preparations. Sometimes we feel that we don't want to impose on our healthcare providers by asking them to do things differently because we know they are rushed. We know they've got a lot to do. We know they have other patients to see. And so we don't want to impose more of our needs on them. But your healthcare providers are here for you too. And they, even if they're rushed, they want to do a good job. They want to take care of you. They want to do the right things. So you can help everybody help you. Again, when you let them know this is the best way to communicate with me, and I've done some of my homework to prepare for this encounter. So let them know, do you need extra time to get words out? Um, do you want them to wait quietly? Is it okay if they fill in the blanks? If you use tools and strategies like a whiteboard or texting on your phone or a picture board or an electrolarynx, whatever it is that you use to communicate, do not hesitate to bring that out and use it. Have your materials ready. Don't necessarily expect them to have the materials. You bring the materials. If you did forget your whiteboard, ask them, hey, do you have some scratch paper and a pen I can use? And let them know. It's best if I write things down. Give me a moment to write, that type of thing. And again, you help them when you do a little bit of education for them. Have a plan to back up information that is discussed at the visit. Again, if you're prone to some fatigue and some brain fog, do not put pressure on yourself to walk out of that visit and just automatically remember everything. And even if a family member is there, and it's great to have a family member there to help you remember things, don't expect them to remember everything. They've got a lot going on, they've got a lot on their mind. So it's kind of unfair to walk out of the visit and ask your family member, did you get all that? And if they forgot something, to get mad at them. Back things up in writing. Now, this is getting easier because a lot of times these days, your healthcare provider will be documenting the visit in the medical chart, and they might even give you a printout summary of the visit right at the end of the visit. If they don't, you can ask for that. Can you say, can you print out the summary of the visit from the medical electronic portal? Also, get that access to that portal because you can log into your own healthcare portal, and in most cases, you can see the note that your doctor or nurse or therapist wrote about the visit. It may not show up immediately, so you need to give them some time to get it in there and let it get through the system, but you can often look it up and see exactly how they documented it, and what you talked about and what decisions were made. If a family member is there, maybe they can take notes for you if you don't want to take notes for yourself. Also, some clinics can provide a note taker for you. If you ask, particularly in advance, if you're going to be there by yourself and you want something to walk out with, you can ask, is there a nurse or an assistant or a medical student or somebody who could sit in and take some notes for you? Let your healthcare provider know how it's best to communicate with you between visits. Many times a healthcare provider may call you up to talk about the results of a test, results of an exam, additional information you need to know, and that back and forth information over the phone can be nice. However, if you are finding that the phone is a really difficult communication situation for you because of your own speech and voice, then maybe that's not the best way to communicate. Or maybe you can ask the physician to call at a time that you would know a family member would be available to help you, and you can all get on the speakerphone together with the family member, yourself, and the healthcare provider. And so your family member can listen in and maybe help you communicate over the phone. Maybe your healthcare provider would be available and willing to get on a telemedicine visit with you. So even though you're talking over distance, you would have face-to-face communication. And again, maybe a family member can be present to help. If it's really best for you to not talk through speech at all, maybe you can communicate through your electronic portal through a form of messaging or email that the portal involves. Now, that is not going to be as immediate for communication. And so, if there's a more urgent need, your healthcare provider really is going to need to talk with you or your family member in a more immediate manner. But the back and forth messaging through your healthcare portal can be really nice for things that are not quite as urgent. Also, be sure and clear to give your healthcare providers permission to communicate with family members if that's okay with you, and specifically which family members. That can be very helpful for healthcare providers to know. Yes, it's fine to talk to a spouse or a partner or other family member or a paid caregiver. It can also be helpful, for your healthcare providers to know that what type of information is okay to leave on a voicemail for you. They may be very reluctant to leave sensitive information on a voicemail, particularly if it's a voicemail that family members might have access to. They are very cautious about confidentiality. So if you tell them it is fine to leave any information on a voicemail, that can help put them at ease. Or if you'd really prefer that they don't leave information on a voicemail, tell them that as well. I am putting a reminder at the end of all these videos that speech language pathologists are here to help with all aspects of communication. Your speech language pathologist may be working in a clinic alongside your otolaryngologist, and you might actually be seeing them at healthcare provider visits together, which can be really wonderful for them to step in and help with communication. Even if your speech pathologist cannot be present with you at a healthcare visit, they may be able to help you with more strategies tailored to your own personal needs about how to make communication with your healthcare provider work in a more effective way. And your speech language pathologist can also put in their own notes some recommendations for other healthcare providers to follow to communicate with you. So use your speech pathologist as your ally, and they can hopefully help you smooth through this path. Thank you for this time. I hope these tips will be helpful to you as you navigate your healthcare encounters during this time of head and neck cancer. And I wish you all the best.